Cultural awareness, an overview of Pakistani culture and healthcare. So this is an image of Pakistan on the world map. You can see that it's colored green to match their national flag. So cultures in Pakistan. Pakistan, like Canada, is a very diverse country with multiple cultural influences that are derived from neighboring countries, such as India, Afghanistan, and Asia. Subcultures in Pakistan include Punjabi, Pashtun, and Sindhi, which account for 45%, 15%, and 14% of the population, respectively. Acceptable and unacceptable behaviors. Pakistan has a very respectful culture, and physical interaction such as shaking hands or touching between opposite genders is seen as inappropriate if the individuals are not married or related. What is appropriate is handshakes among individuals of the same gender, or if a man is speaking to a woman and he is not making direct eye contact. So, communication. The official language of Pakistan is their native language, Urdu, but English is also recognized as an official language. So many people living in Pakistan actually can speak both languages. The Urdu language has its own alphabet, which is derived from the Persian or Farsi alphabet. Other languages include Punjabi, Pashtun, and Sindhi, which align with the subcultures in Pakistan. The phrase "peace be upon you" is commonly spoken in Urdu as a greeting. Additionally, greetings include questions regarding one's well-being and family. Along the theme of respect in this culture, time is taken to ensure that individuals feel welcomed, and if communication is between an unmarried man and woman, then the man must not be looking directly at her. As an Islamic state, religion has a large role in many aspects of Pakistan's values and beliefs. One such belief is that illness is an atonement for one's sins. Being a collectivist society places a large importance on decision-making for the well-being of the group. In Pakistan, family honor is extremely important, and many decisions are made in hopes to advance the family's image. For example, the decision to become a doctor is made to reflect well on the family, and for the individual to appear more desirable for marriage. Society is based on prestige of careers, so doctors are valued over nurses and technicians. On that same token, healthcare is valued as it is seen as prestigious. Because of this, women and individuals with lower incomes are often left out of the healthcare profession. So, oral and general health status in Pakistan. It's one of the few countries in the world that still has polio, and this is due to a lack of education on vaccination as well as distrusting vaccinations. There's also a shortage of doctors in many of the health units, and majority of these facilities are without female staff, which creates a barrier for women to obtain their medical treatment. Pakistan has the highest prevalence of oral cancer in the world, and the prevalence of dental caries for Pakistan is about 50 to 70%. Their oral health services. In regards to access to healthcare services in Pakistan are limited, as healthcare facilities are only located in large urban settings. This creates a barrier for individuals residing in rural areas in Pakistan. In addition to this physical barrier, there is a financial barrier for lower-class individuals. This social determinant of health plays the largest role in creating a health disparity amongst the different socioeconomic classes. Oral health services in relation to delivery. So the dentist to population ratio, so dentist to the number of clients that they would see, is 1 to 1,850, compared with the WHO recommended level of 1 to 7,500. So it exceeds that level, meaning that dentists are treating more people than they could probably manage. Dental hygienists are being trained as primary oral health care providers to help the dentists meet the needs of the society. In addition to training these dental hygienists, community volunteers are also being trained to provide dental health promotion and screening services to the vulnerable populations, again to meet this demand and fix this lack of professions in this field. Perceived challenges during care. women from Pakistan may be uncomfortable with a male healthcare professional providing their treatment. Additionally, they may not be accustomed to having to make decisions for themselves, as it's usually the males of the household that are the decision makers. Lastly, the Western approach to illness and treatment is not common in Pakistan and may be an issue when trying to provide education on disease causes and treatments. Modifications to care. Provision of care may need to be done by a healthcare professional of the same gender to ensure the client, male or female, is most comfortable. Extra time may need to be taken to fully explain what is meant by informed consent and its importance. Care must be taken when discussing causes of illness and treatment options. The healthcare professional must be sensitive to the belief that illness is an atonement for some sin and should factor that into treatment planning so the client feels heard and understood. Lastly, as part of the Islamic faith, individuals pray 5 times a day and appointments should be scheduled around these times, which are morning, noon, afternoon, evening, and night. Thanks for listening.